You did make mention of the universal coverage. Can you say anything about that? I think some people don't understand what that means and how it works. Please help us.
Okay, so for the universal health coverage, it has been a campaign that has been ongoing, and so many people have heard about it, so many people know about it. Although people in the rural communities, the villages have limited knowledge about it. So, based on the fundamental human rights, where every country signed in, that is in the year 1948, where president of every country made commitment to ensure that yes, every citizen of the country has right to health, irrespective of their background, irrespective of their religion, irrespective of their socioeconomic status. They are supposed to have access to healthcare services. But then, when we now bring it back to our country, Nigeria, one of the things that our country has been able to do is to bring in the National Health Insurance Scheme, where people can access quality and affordable healthcare services. But when the healthcare insurance scheme came, it was only limited to government workers at the federal level. Then before subsequently, some states, till today, some states don't have state health insurance. Only few states have state health insurance scheme where their state government workers also access services through that scheme. So in the health insurance scheme, deductions are being made from your income on a monthly basis, and then you and your beneficiaries can access healthcare services. But then looking at people that are not in the formal sector, people that are not working under government, how do you address them? Because majority of people are not working under government. And then what happens to my people in the villages? How do they access healthcare service? And so those state governments were also able to have what we call the informal sector health insurance scheme, where you pay that lump sum amount of money for you to be able to access healthcare services for 1 year. But then, is it affordable? Is it accessible to everyone? The pledge that the Nigerian government made some years back to ensure that yes, all her citizens will have access to healthcare services. Is that happening in this our country currently? You go to the health facility and then you are not being attended to until you deposit a certain amount of money. And then when you don't have that money, you are being neglected. You are an accident victim, and then you are being rushed to the hospital, and then they will tell you you need to deposit 10,000 or 20,000 before treatment commences. And if you don't have such an amount of money, that is how you will bleed to death, and then they pick you up and take you to the mortuary. So it is really, really unfortunate that such a thing is happening in our country, Nigeria, because for us, we feel that universal health coverage, every citizen of a country needs to have access to health services. It's just like you say, because I am a Nigerian, I can go and vote. So let it be that because I am a Nigerian, let me walk to any health facility and access affordable healthcare services without any form of discrimination. But it is not happening in our country. You have to drop a huge amount of money. And for those that said, okay, we have to register under health insurance, how many people can afford such an amount of money to register under the health insurance? So many people do not even have the money to have 2 or 3 square meals a day, even 1 square meal. And then you are telling the person, okay, go and pay such 13,500, and that 13,500 is just for one person per head. So what happens to the other children of a man that has 5 children? Will he be able to afford such an amount of money to be able to enroll all his children in health insurance? And that is why we are calling on the government. You are talking about the commitment you made to universal health coverage. what can you do? What are the policies that you can put in place to ensure that everyone, every citizen, be it a child that was just given birth to in the last 1 minute, how can you ensure that that child access services when he needs it? There are some children that they are being given birth to prematurely. They need to be put in an incubator. And then imagine that I am just a motorcyclist and then my wife comes to give birth in the hospital and you are telling me that there are complications, you need to pay for oxygen or you need to pay for this. Where do you expect such a person to be able to get that money to pay? And that is why sometimes we say, okay, why don't the government even make it more expensive for the airlines, for the people that they know that yes, they have the money, and then make it, subsidize it for the people in the rural communities, for those poor people. You can't just come and equate them with people that are earning. You can imagine somebody earning 250,000 paying the same health insurance with somebody that is earning maybe 5,000 naira or not even earning anything. Those policies don't work like that. At least we need to consider these people. These are people that cannot afford such an amount of money. If really the government is bringing in this health insurance scheme as a means for us to achieve universal health coverage by 2030, then I think there is need for us to develop strategies, to develop policies that will be able to make these people in these rural communities to be able to access these healthcare services. Not to say it is general for everybody, whether you are rich or whether you are poor. No, we are not being fair to ourselves. We are not. And you could see that people that are rich, they are eating good food, they are living healthy. So they don't even need such health services like these people that are poor. It is the poor that needs it. And if the poor needs it, what are you doing to help them? What are you doing to support them? It is not a bad idea to say, okay, pay 5,000 or even pay 2,000 naira in a year, at least just for them to access this basic. In Nigeria, most of our basic ailments are malaria, most of our basic ailments are typhoid. And so if, because I am in the rural community, I cannot afford 5,000 or 12,000 to access these health services, I lose my life. I think the government have failed Nigerians. The government has really failed us. So I think we really need to wake up. Yes, for an individual, you can say, I will work and be able to get the money to access those health services. But what about those people in the rural communities? In fact, looking at people with disabilities too, we need to see how they can help them to be able to access these services, not putting it at the same level. When it comes to health insurance, they are treating the rich and the poor on the same level, when you know that the poor cannot even afford it. So why place them on the same level with each other when you note that they
That
cannot
that
afford?
relates to maybe like something I was asking you before, no? That they create facility and the facility is not affordable to the people in the environment they created it for. So I don't understand why the facility is there. Sort of, it doesn't make sense. Anyway, thank you so much, dear Regina. This has really be very interesting, the conversation. Now, say people want to connect with you. Maybe somebody want to know more about what you do. I don't know if you have a book there that you're selling or anything. Use this moment to promote yourself. Go ahead.
Okay, so like I introduced myself initially, I'm Regina Dogo and I'm also a passionate development worker. I've worked in the NGO space and I have so much passion for people in rural communities, and I want people to work with me to see how we can reach out to people in the grassroots, especially in northern Nigeria, in trying to empower women to be self-reliant, to also access healthcare services when the need arises. So on my LinkedIn, my name is Regina Dogo. You can get me there. On Facebook, I'm Regina Miracle Dogo. And if you want my phone number, can I drop my phone number?
Well, the choice is yours, but then you're going to be waiting for the code.
Okay, we can connect on LinkedIn and on Facebook and Twitter too. So I think it's fine by me.
All right, that's fair enough. What do you think need to happen in order to improve healthcare in Nigeria?
Well, first of all, we have to look at our policy makers. You know, our policy makers, they stay at the policy levels. They are enacting policies without going to the grassroots to get contributions. And so we are looking at a system, we want to see a system rather, where people at the grassroots will participate actively in formulation of policies that will affect them at the grassroots. So we want to see a situation whereby we have the women represented, we have the youth represented, we have the men represented, not just at the federal level or at the state level, but right from the grassroots level. Why? Because these people are living in the community and they know where it pinches them. So when you come and sit with them and you now ask them, okay, what are your challenges? What are your problems? And then when you itemize all those things, okay, you now said, okay, what are the possible recommendations? What are the things that you feel we can do to address these issues? In one of the rural communities where I work, I went to the community, there's no light, there's no roads, there's no water. The education is only primary school they have, and the roof is leaking seriously. The community is here in Abuja as I'm talking to you. And then I have a discussion with the adolescent boys. I had a discussion with the adolescent girls. I have a discussion with the women groups. I have the discussion with the men. You understand? Now, each of them now itemize their pressing issues, what they want. And then I had to tell them, okay, can you put it in and prioritize it, like which one is the important. Even the health facility, they is just, they were the ones as a community donated that room to for them. In fact, it was an NGO that came that they wanted to support them with some medication, and then they had to donate that structure. They came together as a community and built that structure, and then the organization now dropped those drugs for them. And then the healthcare worker, she comes in once in a while, you understand? So when you have that discussion with them, and then you now try to prioritize, okay, what are those pressing issues? You know, for them in the community, they need water because they had a stagnant water where these Fulani herdsmen also bring in their cows to also come and drink those water. So they had a challenge of water, which was first on the list, and then we now started listing out the others. So if at the policy level, government can bring representatives from this grassroots, bring them together. Okay, what are your problems? How do you think we can solve these problems? They will tell you, and before you know it, you will be happy, and these people too will be happy. It's rather unfortunate that even after having all this interview with these people, I could not help because I needed support to drill a borehole for them. But the cost of that borehole was on the high side, so we had to suspend it. But then if the resources is there, I want to see that that community strive. I want to see the children in school. I want to see that, like now, the rainy season is coming. You can imagine you are in a learning environment and the roof is leaking. So how can a child be comfortable to learn in such an environment? A child is sick, and then for you to access healthcare is a challenge for you. There is no electricity and all that. And then for you to be a chairman, you come and you ask for their votes and all that. And then they go out there, they still vote for you, and then you still don't fulfill those promises. So if at the formulation of our policies, the government can consider people in the grassroots, bring them to the table, have a dialogue with them. And then after that, make sure that, yes, the government commits to providing those infrastructures for the people. The people are not asking for much. Just provide them with that health services, provide them with the water, provide them with the educational services. That is just all. It's not much to ask. If we can do that, I think we can go a long way in moving forward in this country.
Is there any other thing you would like to say to conclude it?
Well, since you are over there and I'm over here, and I also have these communities that I also need support. So if there is a way that you can also get some support for us so that we can be able to improve the lives of these people, I would really appreciate that. I also thank you for having me on this podcast. I really appreciate that. And thank you very much.